but we don't have any new directives that'll be coming out today. Today we're joined by Supervisor Nathan Fletcher, who is serving as the Board Coronavirus Subcommittee along with myself. We also have Dr. Wilma Wooten, the county's Public Health Officer, and Dr. Eric McDonald, the Director of the county's Epidemiology and Immunization Services Branch. In just a moment, we're going to hear from Dr. Wooten, then we'll hear from Dr. McDonald, who will update us on the situation at Miramar. Our regional partnership remains strong. For example, we're fulfilling from cities and other public agencies for hand washing stations, and we're seeing good collaboration all around as we try to stem the spread of this virus. We've placed 186 hand washing stations, and an additional 78 will be placed shortly. Please rely on, people rely on services from the county, and we are continuing to carry on business with critical services, but we are adjusting where we need to. For instance, our county libraries are still serving the public, but they are moving to drive-by drop-offs and checkouts. Before we introduce our speakers, I want to note that we received some feedback yesterday from the public and the media on the availability and the reporting for reporters with the microphones. And so what we've done today is we're going to ask you to line up at the microphones as you're identified to ask your questions. That way your question will be heard by everybody. By the way, I want to thank a lot of people that have expressed their concerns about my voice. I want to assure everybody that I am in good health. I had some vocal cord surgery about a year ago, and I'm still in recovery, so I may sound a little weak or lack of forcefulness in my voice, but I can tell you I'm feeling very well, and I appreciate people's concerns. With that, let me introduce my colleague, Supervisor Nathan Fletcher.
Thank you, Supervisor Coxon. Thank you, everyone who's here. The county's commitment to tackling this remains. Our Emergency Operations Center is up and running with all of our partners proactively working to make sure that we are taking every possible step we can to adjust and respond and confront the challenges in front of us in real time on a daily basis. We continue our active engagement with all of the various sectors to make sure they are getting the information they need, along with the ability to ask questions and have information presented to them. Today, Dr. Wooten and I did a series of virtual meetings, of video conferences, first with our education community. We joined County Superintendent of Public Instruction, Dr. Paul Gothold, along with all of the superintendents of all of the San Diego County schools in a video conference providing updates, status reports, engagement. We appreciate their help and collaboration, and in particular their efforts to continue to provide food service and meal service for those families who are most in need, and we stand as strong allies and partners with our educational leaders. We also did a separate call with our early childhood education community. We did this in partnership with the First Five and with the YMCA Child Care Resource Services. They are the official liaison, they are the official licensing entity for the County of San Diego, and the YMCA Child Care Resource Services is our partner and our liaison in all of these. We again provided information, we addressed any concerns or issues they may have, and those continue. Tomorrow we have similar type gatherings scheduled with the business community, with homeless advocates, and with the faith-based community. The engagement with each of these groups is not limited towards our video conferences. It is an ongoing effort. County has dedicated staff for each of these sectors to be their liaison, to engage with them and answer questions. When it comes to the homeless, we now are at about 1,100 motel rooms that are available for individuals who are exhibiting symptoms or showing symptoms. We are in ready communication with our healthcare providers, with our shelter operators, with everyone else so that they know how to facilitate folks' entry into that. In addition to that, we have our homeless outreach teams, our HOT teams, who have public health nurses with them, and they are out throughout the county. They are not just in the downtown areas. They are now spreading into the north and other areas in the county in an effort to engage with our homeless population, make them available, let them know about available services, along with providing hygiene kits and healthcare screenings, and we will continue to do that. We also are in regular communication and contact with the City of San Diego with their announcements that they make. I talk daily with the Mayor of San Diego to make sure our efforts are fully coordinated and anything that they need, they have, and likewise, and vice versa. Those efforts will continue along with the open engagement with the mayors and cities of the other 18 cities throughout. We do want to let the public know that we have added a text service, a text messaging alert system for updates on COVID-19. City allows county health officials to send real-time information about developments on an instant basis. To sign up to receive these messages, you simply text COSD COVID 19, the number. You text that message to 468-311. I tried it out earlier. It works. So again, you would text COSD COVID, the number 19. You would send that message to 468-311. That message is also on the front of the podium, and we will be putting out further information so that you can get real-time updates. And although our libraries are changing the posture, the county has a really incredible service of ebooks. There are thousands and thousands and thousands of ebooks that are available to anyone in San Diego County that you can access and download on your phone or tablet device. And I did it yesterday. I signed up for it. We made a little instructional video. It's really, really, really easy. And so we would encourage folks, you don't need a library card. You don't need any information. You just simply download the Libby app. Just search for Libby, search for San Diego County Library, and then you will get connected and you have access to all of those. And then last thing, our San Diego COVID-19 Community Response Fund. Yesterday we started at $1.3 million. We will have a release coming soon, but the totals that we've received in the first 24 hours is exponentially greater than where we started. It has been incredibly encouraging to see the community come together, some very generous individuals and entities making substantial contributions, along with an indescribable flood of folks making small donations and joining in. And so we're very, very grateful for that help and support. For more information on that, you go to sandiegofoundation.org/COVID. Folks can donate there. They also can get information on how to access those funds. So all of our efforts are continuing full speed. We are reacting in real time to needs of our partners and our allies in this effort, and we will certainly continue to do that. And we're, as always, very grateful for the help and support of our public health experts and professionals. Thank you.
Thank you, Nathan. Next, we're going to hear from our County Public Health Officer, Dr. Wilma Wooten.
Thank you, Supervisor Coxon. Thank all of you for being here today. I'm going to be very brief because we want to allow you all to have questions. I'm going to just share with you the stats for where we are as of last evening and some additional updates, and then Dr. McDonald will go into detail about the additional update and then the Miramar situation. So, first of all, as of last evening, we have had a total of 55 cases. So this includes 20 females, 35 males, and in terms of the age distribution, there are no cases 0 to 17. We have 42 cases 18 to 64, and 13 cases 65 plus. Our youngest case is about 21 years of age, and our oldest is approximately early 80s, about 82. So in terms of hospitalization, of the total number of cases, 10 have been hospitalized, and to date, we thankfully have not had any deaths. Now, comparing that to the nation, there has been, as of this morning, over 180,000 deaths, and over 180,000 cases, and over 7,000 deaths. So these numbers are changing progressively each day. Also for the state, at the end of close of business yesterday, there was a total of 335 cases, 6 and 6 deaths. And then for national update, we have had a total of 4,138 cases with 71 deaths. And we also, this afternoon, are working on 2 additional cases that have been reported to us that will be in the end of the day sit rep or report for our cases. And we may specifically get other cases from the local commercial laboratories as well as the hospitals. But in terms of cases that we're working on that are being run at our public health laboratory, that run's not completed yet. But again, we will report out all of the known cases that we have as of 5 o'clock this afternoon. Now I would like to invite Dr. Eric McDonald to come up and talk about a little more information, high level, on the additional 2 cases that we do know about and are working on this afternoon, and update us on what is going on at Miramar. Dr. McDonald.
Thank you, Dr. Wooten. Actually, I'll just briefly describe the fact that we are investigating 2 clusters of illnesses amongst the 55 cases that were described by Dr. Wooten. One is a cluster of 4 individuals who apparently contracted the virus in the community. 3 of those individuals are at home on isolation, and 1 of those individuals is hospitalized. These individuals are known to each other, and we've identified close contacts of those individuals. This investigation is being conducted jointly with the military because some of those individuals are active duty members, but that investigation is currently ongoing. You may have heard about one of those cases that was announced by the Navy as one of their first cases here in the region. And the other cluster that's being investigated is a group of 7 individuals who were on a ski trip to a county in Colorado. Colorado issued an advisory that there were cases that were confirmed in several counties where there were ski resorts. This group of individuals received that information, and when they started to develop symptoms, presented for care. There are 7 individuals total. 1 of them is hospitalized, and 6 of them are not hospitalized in home isolation. That's all I'll say about the current investigation. Again, they're all under investigation, and we will have developing details as time goes by. I did want to mention briefly the conditions at Miramar, which are going very, very well. I'm the Health and Human Services agency's liaison to the operations at Miramar, and it's worth noting that they've had a total of 489 individuals who have been flown in from the cruise ship that was evacuated for cases of COVID-19. Over the course of the last several days, 132 of those individuals have left Miramar and been flown to various states across the country where these individuals are from. This leaves 357 individuals as of last night who are here at Marine Corps Air Station Miramar under federal quarantine. And there were plans to have up to 115 individuals flown out today. They are operating basically many flights to many states. They call this operation Homeward Bound, and all those individuals will be continuing their quarantine in their home states. There are 136 California residents who are at Miramar under federal quarantine, and there are actually only 2 San Diego residents among the group there. The county has been in contact with both of those individuals and been providing some of their supportive needs while they remain in federal custody. There are 2 major activities that the county has been supporting with the federal quarantine at Miramar. The first is higher level medical care, and there have been 7 individuals who have left Miramar and needed to go to our hospitals for higher level care. 5 of those individuals are still hospitalized, and 2 of them have actually returned to Miramar. The other support that we have provided is laboratory support for testing primarily of these individuals who are leaving Miramar or are persons under investigation for developing symptoms. And it's that total that you've seen on our website. I think it was 4 last night, and today it's now 5 individuals who are positive for the COVID virus. Those are my updates, and I'm available for questions afterwards.
Thank you, Dr. McDonald. Before we get to the questions, let me just take a moment to thank the media for getting the word out in regards to the measures that the County of San Diego are taking. We know that this is a difficult time, but we certainly need to get out accurate information into the public in a very timely manner, and we really rely upon the media to do that. I know you guys are working long hours too, so just suffice it to know that we really appreciate your help and cooperation. At this point, what we'd like to do is take questions. If you have questions, we would ask you to line up at the microphones and go ahead and state your name and the media you represent, and then go ahead and ask the question. We'll direct it to the appropriate party.
Hi, everybody. Artie Ojeda from NBC Channel 7 News. When you mention the word clusters, that gets my attention, our attention. Now, is this just a matter of cases that where you did a contact history and found that that's how these cases are related? Can we expect more clusters to be announced once we learn more of contact histories for those who have tested positive?
Yes, that's a great question. Again, when I say the word cluster, it's in fact individuals who are close contacts of each other. It's usually identified when one person presents for care. We do interviews, and those individuals who are close contact may endorse symptoms, and we encourage them to go in and seek care. That's the dynamic of at least one of these investigations. The others are when you piece together, when one person comes in for care in one location, somebody comes in for care in another location, and you find out that they have the same social network and are able to link them that way. And that is indeed what we did with the military-civilian cluster that was identified. So it shows you what we do in the background with our investigations. Each of the individuals is interviewed. We ask about their activities. We find out who their close contacts are to give them information about what to do if they have signs and symptoms, and that's how we have successfully linked these groups together. It appears that the group of individuals who are on the ski trip together is a well-defined group, and we're confident that they and perhaps some household members will be able to contain that cluster. The other group is still under investigation.
So, and just a quick follow-up. There was mention made last week of 2 Colorado cases. Are those 2 Colorado cases connected to this particular cluster? And is the expectation that there will, in fact, be more so-called clusters?
Well, yes, this group is the Colorado cases that were referred to before, and so it has grown from 2 to 7, and it may be larger over time. And yes, I would expect other clusters to be identified. That's why we do these contact investigations. We urge people, if they develop symptoms, to who are close contacts, to be tested so that we can, again, draw a circle around those to be able to contain it.
Hi, I'm Claudia with Univision. So yesterday we mentioned something about a form that businesses can fill out to see some sort of support or compensation. Is there any update on that aspect?
We have the form. We'll track down getting it put on the website and making it available. So we definitely have it, so we'll get that pushed out.
Hey, Rachel Bianco, 10 News. Yesterday you had mentioned that you're working on some possible solutions for people who are struggling with childcare. Is there any progress on that front?
Well, currently, childcare is still, facilities are still open. We have not issued any guidance on whether or not they should be closed but we actually did have a call with them today and recommended that they follow the guidance in terms of social distancing. So if they have a facility that's large enough to segregate the children into groups of 10, if they have the adequate supervision for that. But we have not issued any specific guidance to date regarding childcare. We are waiting for guidance from the state so that we can implement locally.
Hi, Andy Dugleth with KPBS. What are you doing for nonprofit health clinics that are requesting help with getting masks and other personal protective equipment?
So there have been changes since, say, 10 days to 2 weeks ago. So we are able to provide now, because we are able to use the N95 masks that we had on hand that had expired, but the federal government and CDPH say we can now use that. But more importantly, we have changed from droplet transmission to aerosol transmission. So that allows healthcare workers to use regular surgical masks if they are interacting with someone in the emergency department, as opposed to using N95 masks. We recommend the use of N95 masks if there's a procedure performed that produces aerosolization.
You said it backwards. It's going from aerosol to droplet. Sorry.
I did say, well, I don't know what I said, to be quite honest with you, but we have changed to go to droplet transmission. Was that understood? No, okay.
So you went
Yes,
from
all
aerosol
right.
to droplet?
Yes, we did have guidelines for aerosol, and now this weekend we issued a KHAN to change to droplet transmission.
Brad Racino, iNews Source. I had two questions or specific to the H1N1 report that you had written up in 2012 and then the HEP-A after action report, but I also don't want to hog the mic, so I'll just ask a few here and then
Yeah, sure.
circle back. So one of the recommendations from the HEP-A after action report was to provide online training on the incident command system and emergency response to identified staff by June 30th, 2019. Can you talk about how many staff were identified as needing that training and whether they completed it and when?
All of the staff in the Health and Human Services Agency, and we completed it by the end of June.
Okay, and then there was another recommendation about for continuing to work with the CDC to use testing modules to determine relationships between specimens in an outbreak and formalize relationships with external organizations to build capacity. Same deadline, June 30th, 2019. Was that also completed?
Can you read that again, because I didn't hear you?
Sure. It's recommendation number 20 calls for continuing to work with the CDC to use their testing module to determine relationships between specimens in an outbreak and formalize relationships with external organizations to build capacity in bioinformatics. And that was a June 30th, 2019 deadline. Was that completed?
Yeah, it was looking at if there are partnerships that we can develop to help enhance our public health laboratory testing capacity. And we worked with UCSD and Scripps, and we did actually stand up our capacity for testing for hepatitis A during the hepatitis A outbreak. Pretty much during most of the situations that we've had to deal with previously, we have brought on that testing capacity in our public health laboratory. So now we are testing during the hepatitis A outbreak for hepatitis A, but we could also use those instrumentation to test for C and B as well. And then now with, and I think you heard about this, I don't know if it was yesterday or not, we are working with Radies to provide enhanced capacity for testing for genomics testing. So that process is being worked on as we speak.
Thanks.
I'm Paul Sisson with the Union Tribune. I wonder, you talked a little bit about hotel rooms for folks who may not have places to live. You've also talked about how many folks are not being tested right now because they don't meet certain testing requirement, even if they do have certain symptoms like a fever or cough, and often they're calling into their healthcare providers and being told that they can't be tested right now just because they don't quite meet the requirements. Could you A, say a little bit more about what those requirements are, and B, talk a little bit about how these folks should be separating themselves from the rest of their families if they do think they're sick? Maybe they are like a single parent or something and don't have childcare.
Well, I'll start and then I'll have Dr. McDonald talk, and part of that is going to be for Supervisor Fletcher. So in terms of and this was last week, we had limited supply. We have more supply now, and we will have more supply, but at that time, hospitals and the commercial laboratories were reserving their supplies because it's not just the test kit, is whether you have enough swabs and the containers to put the swabs in and the reagents to test the specimen. And last week, there was, I don't want to say a limitation, but they wanted to ration the supplies so that they could focus on the most vulnerable and those individuals that were in the hospital. So that, but we called, and this was a commercial lab, we called them last week, and we have worked out several strategies so that people, if they want to get tested, can get tested. And we actually have drive-by testing process that was launched yesterday. And but that is through a provider referral. And if individuals are referred, they can drive through and be tested if they have symptoms. Now, the criteria for testing, particularly if people are to end up being admitted, and just as a reminder, about 70 to 80% of individuals that get COVID-19 have mild to moderate symptoms, and we are messaging that if you have mild to moderate symptoms, much like when you get the flu, go home, go through the process, and CDC just issued guidance today for discharge from home isolation. If you need to be seen by a physician, then you would call your provider and arrange for evaluation in isolation, and then testing would be performed if the provider felt that that was needed. The conditions, number one, if you've traveled to, initially it was China, but it's any COVID affected area. The second criteria is if you have been exposed to someone who is a confirmed case. And the third is if you can't satisfy the first two criteria, if you have a respiratory distress, and particularly if the doctor gets a chest x-ray and you have pneumonia, we're asking the doctors to think about COVID-19. So those are the criteria, and we recognize that if everyone goes to the doctor, we are going to overwhelm our healthcare system. So we are urging people, very much like with influenza, if you have mild to moderate symptoms, stay home and write that out. But if you need to be seen by a provider, then you will call your provider and arrange for evaluation and testing. I think I answered most of your questions. Dr. McDonald, anything to add? Yes, but regarding testing.
I guess what I would interject here is people are worried about contaminating their families if they don't know if
Oh,
they have COVID.
that's the other point. CDC is recommending that if one family member is positive, that the entire family becomes quarantined with the individual that's isolated. That's a recommendation, but some family members may be older adults. So trying to separate them or finding alternate housing, and that's something that Supervisor Fletcher can talk more about.
Paul, on the hotel rooms, motel rooms that are available, the aim was to move aggressively to make sure that we had rooms available for any individual who had a positive test or who had a symptom but did not have the opportunity to self-isolate themselves. So if you show symptoms and you're in a high-risk population, you're in a congregate care setting, we can't allow you to stay in that environment while you're showing symptoms. And so this is where we are going through the homeless shelters and checking temperatures and looking for symptoms. If you show any symptom, you are immediately removed from that environment and placed into one of these rooms while we can then begin the process of testing you. But we don't want to wait for a test if you're in a congregate care type setting. These rooms could also be available for individuals who are positive or who have a contact case or are at high risk, just any individual who doesn't have a place where they can self-isolate or they can go into. And so that is the aim and the purpose, so we can have a facility, we have food service, we have cleaning service, we have medical service on site. Someone from, say, the Princess Cruise Line, if they aren't allowed to stay on base, then we would have a location for them to go to. Now, that is separate and distinct from efforts by the state of California and the Regional Task Force on Homeless, which is just to provide rooms to get people off the streets, and we fully support those efforts, and we think those are valuable efforts. But the rooms we have at those times are dedicated for those individuals who are either exhibiting symptoms or have a positive test or are pending a test, and they don't have the ability to isolate themselves.
I just wanted to make a couple comments about testing, and I know it's frustrating and concerning that we don't have as many tests as we would like. And I think that when we talk about rationing tests, we have to be very careful. Our guidance in our health alerts were for doctors to be submitting tests to our public health lab. And we were trying to reserve those tests for very specific purposes because we had limited capacity, both for high impact situations, as the supervisor just described. If someone's in a congregate facility, you need to know the answer right away to take action. An example would be a person who's in a skilled nursing facility. We did have one of those cases. That person was hospitalized. There were other individuals who were in the facility who were exhibiting symptoms, and all of them tested negative. That was done through our public health lab. That's an example of using our quick reaction force, so to speak, to be able to get answers quickly to help decide that a cluster does or does not exist, or further containment measures need to be taken in that environment. So as we transition to more and more commercial availability, there won't be any barriers to getting testing. It's just that we're not there yet, and that's the part of the frustration. So our public health lab is actually transitioning further into supporting our local labs to become independent on their own. So, for example, Scripps Hospital has a testing capability that they've been using and diagnosing patients. We have been verifying their tests, and we think by tomorrow we will have verified enough positive and negative tests through our public health lab to let them be on their own. They don't have to verify them with us anymore. They can just use those as their confident, confirmed tests. We should be there with UCSD testing capability tomorrow. So that's the role. Just in the last week, we've shifted from that public health action role, which we still have some capability for, into this supportive role so that our hospitals actually can take that over. Eventually, we will see commercial labs doing most or all of this testing.
Rachel, 10 News again. I have two somewhat related questions following up on what you said about the change in the masks. Is there any reason to believe now that this virus is airborne? And also, do we know exactly how long it can remain on a surface?
The guidance that we've received all along from CDC says, and if you look this up, it is transmitted through droplet transmission. So, and if you perform a procedure that produces aerosols, that's when providers are recommended to use the N95 mask. Now, we don't have any evidence. All of the evidence right now points to the fact that it's droplet transmission. Again, that's the evidence or the guidance that we've, from the very beginning, given by CDC.
What about on a surface, how long it can live?
Oh, you know, there are studies about that. It depends upon the type of surface, whether it's plastic or cardboard. It just depends upon the type of surface. That's why we recommend that individuals wash their hands with soap and water. That's the best mechanism or method for getting rid of the virus off your hands. And I think I've said this before, the virus can be on your hands, but it really has to get into the respiratory system. So when you have it on your hands and you touch your eye, your nose, or your face, that's how it gets into the respiratory system.
Andy with KPBS again. For senior citizens that have to stay home, are there any services available to make sure that they're getting food, water, medication, or is that their responsibility?
That actually, by law, that's the county's responsibility.
Okay.
Hi, Gary Worth, Union Tribune. Are any public health nurses going out with outreach teams now at the bridge shelters, or are they at any other places? And also, I was wondering, has anyone checked into one of those motel rooms yet who had, well, for any reason?
I would say yes to all three, and I'll have Supervisor Fletcher provide detail.
Yeah, Gary, the public health nurses are at the bridge shelters. I went down and visited them this weekend, saw them with what they're doing, their screenings and the things that they're doing. They also are with the homeless outreach teams that are going, but again, those homeless outreach teams are not just the central area. We're expanding that countywide to make sure that we are addressing all of those. And the rooms are beginning to get filled, and we're going to, we're working to begin to provide updates on the number of those rooms that are being utilized and filled. So they're stood up, they're staffed, they're ready, and now we're in the process of making the referrals. We've worked out the transportation for how individuals get there and where they go. And so we're beginning at all of the shelters, along with our healthcare providers and others, know the protocol and process by which they get someone into one of those rooms.
Okay, I heard they hadn't gone out yet, like at the Alpha Project. As far as outreach goes, they've been.
Okay, I was at the Alpha Project this weekend talking to our public health nurses who were set up in a tent there.
I'm sorry, I meant outreach into like the canyon areas, unsheltered people going out on the street, to the people who aren't there, though, in the shelters, but who are out, the unsheltered population.
Well, at some point they weren't there, and then at some point now they are.
Okay.
Thanks.
Brad Racino, one more question from my news source. Can the county talk about what you say to healthcare workers who believe they're being put at risk by mask rationing and that they believe they may contract the virus and spread it around the hospitals?
Well, Dr. McDonald can correct me if I'm wrong, but while there's been information in the news that we have had positive cases of healthcare workers, it has not been as a result of exposure in the hospital.
Okay.
That's one thing. So we have not had any cases that have occurred as a result of exposure in the hospital.
Okay, but has the county heard any concerns from nurses unions or others?
Well,
Healthcare
we
workers about
use
this?
droplet transmission for influenza all the time. So when people come into the emergency room, there are many infectious diseases that are transmitted through droplet transmission. And that's what CDC says this particular virus, that's how it is transmitted. So we're not doing anything. Initially, people were very afraid, and fear drives a lot of actions erring on the side of caution. But if we look at the science supports that droplet transmission. For droplet transmission, health care providers can use the regular surgical masks. If they are producing aerosolization or conducting procedures that produce aerosols, then they should use the N95 mask. Dr. McDonald?
I think that's a very good question about concerns that healthcare workers have. I know that we've heard in our epidemiology program concerns in doctors' offices about that, and there are likely some individuals who work in the hospital environment who are concerned. There are physicians and nurses and other providers who work with patients who have infectious diseases all the time. They deal with the aerosol transmitted diseases and droplet transmitted diseases, and they have a very good comfort level with that. As we've needed to expand the number of people who have to work with patients who have a droplet transmitted disease, they need to be educated and they need to be comfortable with that. And I know that our hospital partners have been working very hard with their healthcare staffs to be able to understand the transmission, to understand the protections, and to be comfortable. It's a process, though, and so until someone has gone through that process, they might not feel that they're completely ready themselves. And we do have evolving guidance on protection that makes it confusing, and concerns about whether there'll be enough supply that, again, heightens anxiety. So I think all these contribute to anxiety, plus a lack of knowledge is what leads to that discomfort. But I think that our hospital systems especially, and reaching out into the clinics, are becoming much more educated about this so they can become more comfortable.
Okay, we'll take two more questions.
I have one more question about the clusters. Of course, we know a lot of families go skiing for spring break. Can you give any more information about the location in Colorado? Anything at all?
Yes, there were, I believe, 4 specific counties in Colorado, and I can't remember them off the top of my head except for Pitkin County, just because I've personally been there, Pitkin County. But I would look that up on the Colorado's website. They have a nice discussion about the travel advisory because of that. But I think that's a great question. People are planning trips. You shouldn't be planning trips right now. I mean, you should be doing the things that we have both ordered and recommended about lowering your social engagement with other individuals in the community. So planning a trip now really isn't consistent with that. So I would not do that. And I want to hasten to add, although people should be social distancing from each other, they shouldn't be emotionally distancing themselves from each other. I mean, that's an important thing for us to learn. I mean, we're used to doing those things together, to being close in both of those ways. And every family, I know my family's dealing with this, every family has to deal with that in their own way. And again, I want to make this about what people can do. And that's a great segue for it. You shouldn't be planning trips. You should do all the things that we actually outlined in detail yesterday in terms of actions people can personally take, and they should take as families.
Let me go over here. I'll tell you, we started with Artie. We'll finish with Artie. Go ahead.
Hey, Paul, DUT again. You issued a couple big orders yesterday, one regarding bars shutting down, another regarding businesses going, restaurants going takeout only. Very big announcements. How's it going out there? Is everybody shutting down? Have you had to do any law enforcement around these issues?
Department of Environmental Health is responsible for sending letters out. That information actually went out yesterday via email. We do have law enforcement ready and able to do what's necessary to help enforce that order. So we're 24 hours in, and we've notified all of the businesses, and we are asking them to comply with the order. Yeah, sure.
Actually, I just want
A
to
follow-up also in terms of the hospital shutting down elective procedures. I've checked with a few today. Some of them are shutting down, but it's not like there's been a bright line. I noticed you guys didn't set a specific date on that, and I wondered if you might talk a little bit about why not just say cut it off tomorrow. Why not put a date on it?
Can I answer that?
I'll let you answer that second question, but I really wanted to sort of follow on. I actually went to a place to get coffee before all of the orders were announced, and they were already doing most of the things that we were asking them to do before we ordered it. And I would say that that's probably true of most of our community businesses in San Diego. They were ahead of where we were to be actually instituting these things, because they're watching the news and they're reading your newspaper, and they are adapting and taking these things internally. So I have every confidence that they are continuing on with adopting those types of things. They don't need to be policed for that. I think they're actually doing it on their own to maintain business. I'll lead into the second question by saying that there was a hospital capacity task force this morning in which the hospitals were actually discussing this very issue about how to reduce their activities to be able to concentrate on the potential for incoming patients. And Dr. Wooten, I think, was on that call, so you can probably detail that.
What I wanted to comment on was the timing. And so at the very top of the order, all of these orders were effective at midnight on yesterday. So there was a effective time on the order. So there were 9 orders, and then there were 3 strong recommendations, but all of them effective yesterday at midnight.
Okay, one final question.
Angela Torres from Zeta Weekly in Tijuana. Is there any information about a vaccine that Innoviolab has been working on, and what kind of collaboration have you with health authorities in Baja California?
I didn't catch the last part, but regarding the vaccine, I actually saw in the newspaper today there's a vaccine that is being is experimental, but even with that, it is going to take some time to bring it to the general public to be utilized commercially. So we are still, and what the federal government is saying is that we're still anywhere from a year to 18 months out from a vaccine. So that's why it's very important that everyone participates in the interventions that we are recommending so we can stop the spread of COVID-19.
And about the collaboration with the Baja California government?
Yeah, go on.
Yes, actually, I would like to answer that question. You know, we both have a county and state offices that are working closely with our colleagues in Baja California, and we actually get daily updates from the federal Ministry of Health, and we also get updates directly from our colleagues in Baja California about cases that are being evaluated. And I can say that they've had no confirmed cases in Baja California as of yesterday, which is the report that I saw. They have evaluated several cases as possible individuals under investigation. One of those individuals was actually someone that our public health lab tested that was in a hospital in Mexicali that was a Calexico resident. So there's lots of jurisdictional issues there, but we routinely investigate communicable diseases together and work together, and we were able to leverage those relationships to make that particular case, which turned out negative, to be resolved. So we are collaborating quite closely with them.
Thank you.
Okay, we're going to cut this off at this point as far as questions. If you have additional questions, you can talk one-on-one with either Dr. Wooten or Dr. McDonald. We sincerely appreciate the media again and their attention to what we're dealing with here with the COVID-19. I want to just emphasize that the county remains open for business, and we're certainly modifying how we're going to provide that businesses. We have a lot of critical services that we provide, child protective services, adult protective services. A lot of people trying to still apply for food stamps and other services that we have. So we are going to be changing the way that we deliver a lot of these services. Just as we announced today, the libraries will not be open to the public, but they can drop off books if they want to call the library or send them an email and let them know what books they would like to have. They will be put together and be made available to be picked up at those drop-off book locations at each of the county public libraries. And we encourage everybody to check the county's website. If you have questions, if you are in need of, let's say, food stamps or something like that, we would encourage you to call the Family Resource Center, or you can call 211 and they can actually get the application going online. We will provide those critical services, but we are going to have to adapt in order to encourage people to keep that social distance and to not come into contact with either our county employees or each other. So we thank you for your attention. We will have another briefing tomorrow afternoon. And again, if there's additional questions, you can talk to the doctors one-on-one. Thank you.